Okay, so welcome to the breakout session, Food Security and Health in Africa, Undergraduate Education Through Participation and Observation. Today we have Dr. Mary Willis, Brianna Heckerly, Maggie Dawson. So Dr. Mary S. Willis is a professor in the Department of Nutrition and Health Sciences at the University of Nebraska-Lincoln in Lincoln, Nebraska. Dr. Willis was awarded an MA and a PhD in anthropology from Washington University in St. Louis, Missouri in 1991 and 1995, respectively. A Science and Diplomacy Fellow with AAAS from 1995 to 1997. Dr. Willis worked within USAID's Office of Population, Health, and Nutrition, providing technical assistance to health programs worldwide. She has traveled and worked in Asia, Africa, and South America for 40 years, conducting health and biocultural research in a variety of settings. Dr. Willis became a member of the UNL faculty in January of 2000, working within the Department of Anthropology. In 2012, she joined the Department of Nutrition and Health Sciences, broadening the scope of her teaching and research, and became a Daugherty Water for Food Institute faculty fellow. She's a fellow in the Society for Applied Anthropology and the American Association for the Advancement of Science. She now emphasizes biocultural approaches to food and nutrition, as well as global food security. Dr. Willis began her UNL career studying Nebraska's refugee populations from South Sudan, the Nuer, and the Dinka. While she continues to work with refugees, she has developed an education abroad program on food security, health, and nutrition, and since 2014, she has accompanied undergraduates to Ethiopia to examine the impact of undernutrition on growth-related sequelae and dental health within rural farming communities. And Brianna Heckerly is a senior at the University of Nebraska-Lincoln. Throughout her undergraduate career, Brianna has been involved with research programs at UNL's Center for Brain Biology and Behavior and with Dr. Mary Willis in Dessie, Ethiopia, and Awassa, Ethiopia. Brianna plans to graduate in May 2017 with a Bachelor of Science in Ethnic Studies with a focus in African Studies, and she will matriculate to the University of Nebraska Medical Center College of Dentistry to begin a DDS program in August. And Maggie Dawson is a senior at the University of Nebraska-Lincoln. In her undergraduate years, Maggie has been involved in the Department of Nutrition and Health Sciences and has conducted nutrition research through study abroad programs to Ethiopia and Mozambique. After graduating in May, Maggie plans to complete a year-long dietetics internship, followed by graduate school where she will earn her Master's of Public Health with an emphasis in global nutrition. So let's give them a warm welcome.
This is not the front slot. Can you get that?
Oh, yes.
Do you want this? Thank you.
Am I going further into it? Or?
That's okay. Okay, well, welcome. I'm glad to have you come to hear our talk. We're talking about something we all have benefited from and really care about. I developed this study abroad to Ethiopia in 2014. It was with a grant from the USDA, International Science Education Grant. The USDA has this grant in the Farm Bill, and sadly, it's not been funded any longer, although we hope in the future it'll be resurrected. The reason we hope to have it resurrected is because it's very difficult to develop programs like the one we have participated in each year without having some support and help. And we'll talk about that through this session. And then two students that have participated in the program in the last few years will talk about a little bit about their experience in Ethiopia, but they'll also tell you what they went on to do with that experience, how it shaped and helped them take on some new activities career-wise in their lives. Okay, so sorry, it just takes a moment to get this. Where do I point this?
I'm not really sure, honestly. Oh, you don't need to point it any place.
Okay,
Go
just,
down one little.
okay, and so you just roll it.
Just a little. If you wanna.
I am never good at technology, so this is perfect.
So we can use this there.
Okay, make it just,
This is a little slow.
so it's up and down there.
Mhm.
Okay. Okay, faculty disclosure statement, which had to be in place. The following faculty, myself, have listed no financial interest or arrangement or affiliation that would be considered a conflict of interest. Okay, so we're done with that. Well, why conduct an education abroad program in Africa? This is a map provided by the Institute of International Education talking about programs for study abroad. In the U.S., after looking at years and years of data, only 1 in 10 students will do an education abroad program during the time they're an undergraduate student. And most of these are short-term programs. They're summer programs, and they typically are not academic in focus. They are tours. They're more like a glorified vacation. I don't mean to be disparaging, but what I'm saying is there's not as much academic work involved. As noted here, most students go to the United Kingdom, typically England, and not much of the rest of the kingdom, and Italy and Spain. Those are the most common destinations for study abroad. And very few of the students that study abroad are minority students. Mostly it's females of European ancestry that do study abroad. And almost every year, most of our students are female. And then again, education abroad seldom provides an opportunity for students to do research, to really understand how, even in a short time, they can collect data, they can learn something in a more structured way. And with nutrition, and this is true throughout the U.S., there are almost no opportunities to take undergraduates and have them do a nutrition program and study abroad. So that makes our context rather unique. Okay, so this is the other really important issue. Of the places people go, of the continents people choose for study abroad, only 3% of U.S. students who study abroad ever choose Africa. So this is why the funding from an entity like the USD is really important. We had to set something up and make it attractive to students. Why would you want to go to Africa? And if that's not hard for me to answer, but it's apparently hard for lots of students to answer. So we had the grant, we started off and launched the program. This is sort of the framework of thinking about how to set this program up, and it's been evolving over years. It was not, Maggie went on the first program in 2014. It was not as we hoped it would be, perhaps, but it's developed through time, and Brianna went the next year when it was more developed. But we started with this idea, again, a sort of framework, let food be thy medicine and medicine be thy food, something Hippocrates is supposed to have said. At least he's credited with that thought. And we see people around the world using food in much that way, be it spices or preparation, but food is much more about health. It's connected to health. We looked at activities that we could do with students that would give them a real understanding of food and the impact on the body when it is less than or more than. Typically, in this case, less than one would want for optimal health. So we had the students eventually look at teeth. That's been really important. We forget that teeth are the only part of the skeleton that are exposed to the outside world. And when a body is malnourished and when individuals are in poor health, their teeth are a mirror for that health situation. That is, they're likely to have more decay and more infection in the mouth. So that's a perfect way to look quickly to see how people are in their overall health status. And then one's growth reflects their long history of whether or not they had good or bad nutrition and whether they had enough food. And the woman being measured here shows she's very small, very slight in her height. She's had chronic malnutrition in the past. Her growth has been stunted. And finally, in Ethiopia, we see that body shape also reflects one's health status. This is a little girl that I saw in my first trip to Ethiopia that has kwashiorkor. It's protein deficiency. Very clear and quick to see this deficiency because, again, the body shows that issue or problem. So we start with these kinds of this basic knowledge and then try to incorporate that into studying for students. You might know about the World Food Summit's 1996 proclamation about food security. And this is a definition that is messy. It's been evolving over time, and lots of people add to it on an annual basis nearly. In any case, this is the one that most people still work from and work around. So food security exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious foods, which meets the dietary needs and food preferences for an active and healthy life. So that covers pretty much everything you can think of. It's about having enough food, it's about having access to the right food, and food that's comfortable for your social and cultural realm. So that's the definition that we work from, and we try now to teach students about the 4 pillars of food security. And again, that gives us lots and lots of ways we can build in education into our study abroad, even though typically it's no more than 5 weeks in duration. So the 4 pillars of food security include availability. Availability is what can people grow, what's available in their community. Maybe it's food that's been imported, brought into the country. Maybe it's food that comes from even a neighboring region of the country. But the point is what's available to the population to eat in general. Secondly, there's the issue of access. Even though the food's available, what can people access generally? What can they get from a market? What can they afford to buy? What do they have available and accessible to bring into their home? And then there's the issue of utilization. Once people have food that is available, and maybe they access it very well in a market or they've grown it, are their bodies in the shape where they can actually use that food? If you're ill with any number of diseases, you don't absorb nutrition in the way that you should. So there's that issue to consider. And finally, there's this issue of governance or sovereignty or sustainability as the 4th pillar. And what do people actually have control over? Do they own the seeds of the foods they grow, or do they have to pay an entity, a Monsanto or a company, to actually grow that food every year? That's impacting their food security. So all these issues, again, we use for thinking about and working on food security. There's the issue of climate change adaptation, and regardless of whether or not anybody thinks climate change is something humans contribute to or not, we know, based on data, that conditions on the ground in countries like Ethiopia are really, really dire. Ethiopia's always had cycles of drought, and they've had famine about every 10 years, but now they're having it every 2 or 3 years. And in some regions, it's impossible for them to produce food, so they no longer have access or availability. They don't have sustainability, and in many cases then their bodies can't use the food either. There are issues about gender, about innovation, and about their capacity in any given place or country. So we can study food security and these 4 pillars at the household level, at the village level. We can look at regional kinds of food security issues. We can look at national level issues, and finally we can look at a continent. What's available in the north of Africa is quite different from what's available in East Africa. We've got all kinds of international law, and then we've got local community rules and laws in place, but there are also national laws, state laws in each region of the world. These things all impact the way in which people can access food, the way they find a food available, and so on. So Again, all of these issues have to be considered, and we try when we take students to Ethiopia to see all of these levels. One of the ways we look at a continent-wide issue is we spend time, for example, now at the African Union, and we talk about the plans for the entire continent over time, and what kinds of things can people count on or access, what sorts of health programs are in place that would then let people be healthy and use food in the future. We look at, in this idea of availability and accessibility, we look at all of the farming and crop production systems. What do people grow on their own farm? What do they grow in their local, maybe home garden? Lots of women have home gardens. What can they bring in that way? What are the crops indigenous to place? Are they grown? Are they still something they can rely on year to year? Are there foods, again, brought in from outside? What kinds of ways do they have to minimize pests? Are they doing this with their own? The woman in this picture actually is using a slingshot to keep birds out of her field. She doesn't use pesticides. She doesn't use all of the things that might cost money. Again, all of these are about the availability and accessibility of food. So we look at farming and crop production. And in a country like Ethiopia, we would look at all kinds of other issues. Ethiopia has the largest number of cattle in Africa. That's really remarkable to think about, the largest number of cattle in Africa. And yet, 44% of their children are stunted, and lots of them have signs of protein deficiency. So Maggie, in her interviews that she did in houses in Ethiopia, found that women would say they were lucky to have meat once, maybe twice per year. And so those protein sources have to come from grains. They have to come from lentils and peas and such. If you can't get those grown, how do you get protein in? And once you don't have protein in, how do you treat that cycle? So we can study all of these kinds of issues on the ground. And again, we can look at the health of we look at the climate, and we can look on the ground at the health of the animals. Many times when we think of food security, we talk about people. We don't talk about animals. Many people lose their animals in a drought. That makes food security, again, very difficult to accommodate and work on. And also, again, students can see the effects of drought in the animals and people, sometimes just visually. We look at what's accessible. We go to markets, and we have students map out all of the things available in the market. And I can see changes year to year, but the students can see at least differences between regions, in the grains, in the fruits, in all of the macro and micronutrients available. That's really, really clear. And in different ethnic groups. Some of this is about what they prefer to eat, but again, it's a highly varied situation because you have to think about how people are moving their crops from place to place. Do they have roads? Do they have carts? Do they have markets that can take the produce and the crops they sell? And or do people have access to those materials? Then we come to this issue. We spend time going to health clinics. We go to households. We go to markets. We go to farms. We look at the food that people produce. And then we look at health clinics. What are the most common kinds of issues that people are struggling with health-wise? Well, in this particular region, moderate malnutrition was a really big problem, but so was diarrhea. And diarrheal disease, of course, is a good way to lose not just body fluid, but nutrition overall. So all of these things can be considered, and students can consider, again, the impact overall on nutrition. In most all of the places that we visited, we find signs that children are not getting proper nutrition. Whatever they're accessing, whatever's been available, they're not utilizing well, and or they're just not getting enough of a particular something. So their hair and their skin show signs of difficulty. What we also do that's a very effective way to let students understand growth and development is to have them measure in middle school children weight and height and upper arm circumference, and then look as well at the teeth, a quick exam of the teeth. And in this way, quickly you can see how small children are for 12 or 15. That's really very clear. And you can also see those that have signs of overall poor body health by the condition of their teeth. Oops, sorry. So we look at undernutrition, and again, things like protein deficiency, kwashiorkor. Occasionally we'll see occasionally the students will see evidence of marasmus, which is both calorie and protein deficiency. And this past year we took students into actually it was a Catholic hospital, and it turned out the hospital was treating the child, and the students then put money together, and we paid for chickens to be given to the family, a way for them then to eliminate and not have problems with protein deficiency in the future. But those are things students can learn about and see and actually do something on the spot. We visit different ethnic groups because, again, ethnic groups have different kinds of access. They're in different parts of the country. So we make sure to take students in different places. In both of these photos, one taken more in the northern part of Ethiopia and the other in the very southern tip near the border of Kenya, you can see these children have protein deficiency. They have swelling in the stomach, very small limbs, and again, skin and hair that look less than ideal. There's not any sheen to the hair, for example. The other thing we do is try to situate programs always in a place where food and food insecurity is high. And Ethiopia is certainly one. They are high in all kinds of indicators of insecurity, but they have 25 to 35% of the population considered undernourished. But again, overall children, 44% are stunted. Maggie went after Ethiopia to Mozambique, a similar situation there. This next year, we'll take students to Zambia. While Zambia is a little better off in terms of their overall rates of money, all the economic indicators, they too have about 40% of their children stunted in growth. So again, these are there are all kinds of activities, all kinds of things we can have students do very quickly to see what we see constantly in maps and really it doesn't have a big effect. And then we oftentimes have students, again, do a research project, study some aspect of food insecurity or health or nutrition that's of interest to them, and then write a paper when they get home. And we think often of this concept of Ayurvedic medicine, which is when diet is wrong, medicine is of no use, and when diet is correct, medicine is of no need. That's often what we can show in a 5-week study abroad to a place with high rates of food insecurity. And then the other thing we try to do is throughout the trip inform and talk about what can be done. What can you do in your future? How can you make a difference? What can you do to impact this country or another? And one that is interesting to think about is this idea of indigenous crops. What are the foods that are from these regions, that are grown in these regions, that do well? In Ethiopia, there's a grain teff, which has all of the essential amino acids. It is typically, because of where it's grown, high in iron, and really, really important to encourage people to continue growing this crop. Depending, again, on availability, you see people oftentimes growing other cash crops, letting go of this very nutritious crop to make money. And then the cycle continues. In any case, we want people to learn about indigenous crops. What does that mean? We also want to think about encouraging students to consider not just where the crop is from, but what kinds of things are important for growing crops. That's important to food security. So in Africa, in sub-Saharan Africa in particular, corn is one of the big crops. Now, corn is from the Americas, it's from Mexico, and it takes lots and lots and lots of water. And yet, that's the base for many populations in sub-Saharan Africa. So that's something to consider thinking about in terms of health, in terms of working in agriculture. This idea of general nutrition education is important, and we encourage students to think about nutrition education in their future careers. When you see a population that has lots of money from cash crops, they need to know what to be able to buy with that money. And many times what we found in Ethiopia is people would end up buying Western kinds of things, not just sugared drinks, Coke and Pepsi, but also pasta and rice, because those are things that Westerners like, and that seems a prestigious food, not necessarily something that's healthy. So that idea of nutrition education is important. And then to talk and teach about local and indigenous being good. We too often encourage people to live in a Western way or give them advice that's about Western culture and place. And actually, indigenous culture is pretty darn good in its original intent. And so it's important to give students that exposure to help them understand that no culture is better than another. It's about, again, being successful, living well with what you have in place. And so that's a concept to work on. Particularly students in nutrition, again, to encourage and participation in school garden programs. The World Food Program, as part of the UN, has lots of new homegrown school feeding programs, and they're helping communities grow crops, which have one of the many things children need to grow well, and those crops then are brought into the schools for meals. Kids get supplemental food. So exposing students to those kinds of programs and encouraging school gardens is really, really important. Most of American kids don't learn that as well. It's a good lesson to learn, and something, again, you can see on the ground in many developing countries. This idea of food aid. Most of us don't realize that much of our surplus, again, through the farm bill, most of our surplus grain, wheat, and corn get shipped to countries like Ethiopia. Ethiopia doesn't typically, they're growing more and more wheat now, but it's not their indigenous food. And wheat is from the Middle East, not from this part of Africa. So that's another thing to consider. You know, what are we doing when we introduce food? Students got to see lots of food aid, evidence of food aid on the ground in Ethiopia. Bags from our U.S. Agency for International Development. Again, a wonderful thing to share. But are we helping when we give American foods? And then this idea, again, of trying to not just ship over our excess, what we grow and really don't need, but maybe helping people on the ground to grow there so that they're employing their own farmers, they're able to produce food, again, that they have interest in and knowledge to prepare. Not very helpful to bring a food where people don't know how to maximize the nutritional intake. So with that, I want to have one of our students tell you about her research. Both Maggie and Brianna are doing their senior honors thesis after going to Ethiopia and then designing or deciding to do a project. They'll each tell you about it, the impact of this kind of exposure on their careers and lives. So, Brianna.
So as Dr. Willis said, my name's Brianna, and I went on the trip the year after Maggie, so in 2015, and on that trip I kind of came in with the idea of wanting to do a health career. I was kind of considering medicine, but I had some doubts about that, so I was considering other health careers as well, and I came in with the intent to do maybe a project about medicinal plants or something related to traditional medicine. And I got into the trip and we conducted the anthropometric assessments that she was talking about, and those dental assessments really got me interested. But far beyond like the African experience that I had also wanted as an African Studies minor, and just like in general the experience of leaving the U.S., all of that changed my interest in my career, and I'm using it to write my honors thesis as well, which is proving to be a very positive experience. So I chose dentistry about halfway through the trip, and I was just talking earlier about how I had my mom quickly register for a class that was required while I was in Ethiopia still, and I ran through all the requirements. I took the DAT, and I was accepted, and I applied and was accepted to the UNMC College of Dentistry, which I'll start this fall, which is very exciting. But all of this kind of was bred from my experience collecting data with Dr. Willis. So I'll just kind of go through what that process was like. Going in, we went with some pretty specific ideas about what we were looking for. By we, I mean completely not me, Dr. Willis, who told me exactly what to measure, like you saw pictures of. So we were kind of looking at health status and dental status, and then dental hygiene, and how all of those things were kind of being affected by culture, and of course back onto like through the lens of nutrition and stunting, and how those were affecting those factors as well. So my part in it, like I said, was collecting data at first, and this is where I became really interested. You can see me with short hair, just kind of scrolling down what was going on with those students' mouths. We used interpreters who spoke Ethiopian and Amharic, and then some local languages to kind of ask kids about how they were brushing their teeth and how often, and who taught them how to do it, some questions like that. So we did that in 2 different regions, 2 schools in each region, and so there were 4 total schools, and seeing the difference was kind of one of the main goals of the analysis. So then we got back home. After all was said and done, I entered all the data and analyzed all the data, and then now I'm writing about it for my thesis and hopefully to be published as well. In addition to all of that, we did do the local health center visits. My project, like I said, was focused on like traditional medicine or kind of practices that weren't Western, and so I stumbled across these dental sticks, which were another like huge thing that kind of changed my outlook about like what practices were meaningful and useful in different cultures. These sticks have been being used by humans since their origins, and they have been working very well. They're antimicrobial and antibacterial. You can see her using one in the middle picture. And then this is kind of what they look like more typically. The handle gets carved out like that. Then the top is for use, and they get tubed all the way down like she has. And then beyond that, this guy in the corner is at a health center. He worked at one in the north, and he also taught us a lot about the malnutrition rehabilitation programs, which they use supplements that help with the protein deficiency. And then for the data collection, we went through self-reported sex and age for each of the students, and then took their height and weight, and then measured their arm circumference, which is another indicator of malnutrition, and then did the dental assessments, and then of course the questionnaire like I had mentioned. And so then some of the results, we had 353 total students, and they were more of the students were in the northern region, so 62% were in the Amhara region, and then 38% were in the southern region, which is the SNNP region. The average age was 14 in the middle schools, with about a 2-year difference. And of those students, of all of those students, 68% were underweight and 32% were normal weight. So even to me, a great comparison for that would be to consider the U.S., where probably I wouldn't even say maybe 68% of students would be in the normal category. So this is greatly shifted downward from kind of the students that we'd be working with here. So then for the dental results, the rates of tartar were really, really high through all the schools, 69% overall, and they really stayed in that range for all of them. About 11% of all the students were missing teeth, and only 3 out of the 220 students in the Amhara region had visible dental fluorosis, which is kind of that top picture, the orange coloring. Upon consumption of like too much fluoride when the teeth are developing, this can happen. It's weakened enamel, and the discoloration comes when it becomes more serious. Of course, we see it in the U.S. too, but it's never to this degree, really. It's nearly impossible with the levels of fluoridation in our water, but it does happen. This is kind of the worst case. Of course, it affects the enamel, so it makes decay rates much higher as well. But out of the 220 students in the northern region, only 3 had dental fluorosis, versus in the south, 88% of all the students had dental fluorosis, and that's because in that region, near the Great Rift Valley, the rates of fluoride in the ground and the groundwater are at the highest levels in any parts of the world. And so that kind of consumption over and over again in the food and water at young ages really has these negative effects. And then again, it affects decay rates. So they were roughly double in the south as they were in the north. And overall, about 34% of students had visible decay. And that is unfilled and untreated decay as well, worth noting. For the dental hygiene questionnaire, about 96% said they brushed their teeth, and the average is about 1.5 times a day for all the students. The sticks that I showed you were used by about 80% of all the students, and 30% were using the toothbrush. Of course, the toothbrush is much more expensive and not quite as sustainable of a practice versus the sticks, which are very common and very cultural and very effective, so they're used a lot more. Cleaning with water was the most common, and water was more commonly used by kids in the South who had the problem of fluorosis. Most of them learned these hygiene practices at school or with family, and fewer learned from healthcare workers or from their friends. And another interesting finding was the rate of students with third molars was super high for a younger population. So in the U.S., on the ADA website, it says the average age that someone will get all of their third molars in is 17 to 21, which seems pretty normal. I think, for me, I was a little bit younger than that, but most people I know were about that age when their third molars came in. But at all of the schools, the average age of those with all third molars present was 15 and a half, which is 2 years lower. That's pretty significant. And they're as young as 13.9, which is super duper young to have all four of your first molars in. And so that was another interesting and notable difference between the U.S. population and ours. And of course, it kind of brings to light the idea of our science being really impacted by our culture. We are considering normal this thing that is normal here, but these populations that are less studied have a completely different experience. So all of those things kind of contributed to me becoming really interested in teeth in a way that I hadn't been before, and how they affected health and how health affected teeth. So it was a very beneficial experience for me culturally, but also especially as a professional. And going forward, it was a very positive experience. And I'll let Maggie go ahead now.
Thanks. Hi, I'm Maggie. And as Dr. Willis said, I was able to take part in her first study abroad trip to Ethiopia in 2014. And I actually kind of went on the trip as a whim. I hadn't really thought about studying abroad. I didn't really think it was relevant to my nutrition major. But after taking the class, actually with Dr. Willis, her food and culture class, I kind of developed this curiosity about global nutrition and how nutrition status changes throughout the world and how eating habits can be different in different countries. And so I wanted to see what it was like in a different country and what I could learn and how I could try to apply that to my own studies. So I went to Ethiopia and I had such a good experience. When I came back, I immediately applied for a Boren Scholarship. And the Boren Scholarship is intended to help students or fund students study a critical language in a country that is not usually frequented by study abroad goers. So Mozambique was one of those countries, and I ended up studying Portuguese, and it was an amazing experience. And okay, so this is Mozambique. It's on the southern side of Africa, right by South Africa. It's a beautiful country on the coast. So I started the Boren program. I started in Florida, and that's where I took part in an intensive Portuguese study. That was for a couple months, and it was really important that we learned the language before getting to Mozambique because we were immediately matriculated into their college. So I was taking classes with other Mozambicans, and all of the classes were in Portuguese. So it was important that I learn or have a good foundation in Portuguese prior to arriving in Mozambique. So that was 2 months in Florida, and then when I got to the capital of Mozambique, Maputo, I studied at their university for 4 months. And by that time, I had a very good hold of Portuguese, I thought. And I took an internship with Care Mozambique. And that was another important part of the program. For me, it was very important to stay in Mozambique. After learning at the university, we had the option to leave and go back to the United States after completing our Portuguese semester at the university, or we could have stayed and continued with an internship or a job. And I decided to stay because I wanted to learn a little bit more and try to get some more nutrition research if I could, because my experience in Mozambique, or my experience in Ethiopia, was so good. So I had the internship with CARE, and as part of my internship, I assisted in a new project that they were doing. It was a home visiting project where local volunteers will go into households, and this could be households of neighbors, households of family members, but someone in the community, and they provided nutrition, health, hygiene, education to these families. And these were usually lower income families, families with younger children, families with a pregnant mother, and I was in a more rural area of Mozambique, so we were able to see a lot more of those lower income families. And the volunteers are called Musungukati in the local language, Shitswa, and this means good advisor. They're very influential in the community. They're very highly respected. And it's an amazing program that CARE has developed, because it's very difficult for some of these families to accept outside help from CARE employees, especially if the employees aren't Mozambican or are from different regions. They just don't feel as comfortable, especially talking about things like hygiene and nutrition. Nutrition during pregnancy, a lot of the women don't feel comfortable talking to these people, but the Musungukati are accepted into these households, and they're like family, because they're locals and they're people that the families already know and respect. And so it was very interesting. My role in the project was to review kind of some of the results that the Musungukati had seen in these families, how families' knowledge about nutrition and hygiene had changed from the start of the program to now. And so I was able to see a lot of amazing things, a lot of families who had had malnourished children who were now healthy, a lot of pregnant mothers who had developed, or had, the babies had developed healthily because of the Musungukati and because of the education that they were able to provide. And because I had had a good experience in Ethiopia conducting some nutrition research, even on such a small scale, I felt comfortable conducting my own research in Mozambique. So I studied childhood feeding practices, spent a lot of time in households, interviewing, observing, sometimes participating in some of the preparations. And because I had had that prior experience with nutrition research, I kind of knew what kind of questions I wanted to ask, what things I wanted to look for, areas of study, what I wanted to ask people about regarding nutrition. And I learned a lot, especially about rural Mozambique and prevalence of certain diseases, how it affects nutrition. I learned a lot about different varieties of plants that are utilized. Mozambicans are extremely resourceful, and I learned that very quickly. But they're also very smart, and they know what plants are good and what plants have those vitamins that are essential, but also the vitamins that are lacking in normal diets. And so much that I learned. And one of the more interesting things that I would have liked to have studied further was the role of traditional medicine and nutrition. And it was kind of a taboo subject, but traditional medicine is very common, especially in the rural areas, especially where access to, I would say, a more not Western doctors, but the type of doctors that we think of, I suppose, when you think of a doctor in a hospital. Those access to those doctors are not, the access is not there. And so families have to go to a traditional medicine doctor. And that can be very harmful, especially if they're feeding a newborn child traditional medicine instead of breast milk. So yeah, my experience both in Ethiopia and Mozambique changed a lot of, I would say, what I want to do with my dietetics major, what I'd like to do in the future. It's changed my perspective about nutrition, especially nutrition abroad, global nutrition, and the relevance that it has to, I suppose, to my major.
Okay. Well, you've heard two examples of students that have gone on a short-term study abroad and been able to do something productive with their future. Again, we continue this program at University of Nebraska. We're hoping to always have a trip to Africa, to one country or another in the future. And again, our students are greatly benefiting from that opportunity. Do we have any questions or any thoughts you'd like to share? Yes.
Earlier in the presentation, you said something about not importing as much wheat and corn and growing more local crops.
Mm-hmm.
If they're not getting enough of those crops already, how do you increase that, or maybe send a different crop over, one that'd be more helpful? What are some alternatives?
Well, I mean, this actually came up during the Obama administration, and it was a huge uproar with our farmers here, because they, of course, make money from doing those surplus crops. And the issue kind of is, I mean, we are generous, and it's something to be proud of. I always feel proud to see USA on the ground when I know people are starving. That feels great. But one alternative is to help farmers pay for the materials they need, be it water or some additional seed or, in some cases, some soil nutrient, and paying them to do their work locally. And that's kind of what World Food Program has done with their homegrown school feeding programs. They're helping people maximize what they already have in place and also create a sustainable system. What's a little worrisome about Ethiopia is the drought is cyclical, and now it's worse and worse with climate change. So our programs need to be sustainable. That's what's really important. So I think your point is a good one. It's a very complex system, but one of the things, again, it seems silly that Americans would be surprised by food aid, but most Americans don't even know how much money out of our national budget goes to development or goes to help poor countries, and they have no concept of what it's like to see poverty in the way in which you can see it in a developing country, or even what malnourishment looks like. We have lots of malnourishment in the U.S., but it's overnutrition, right? And people have a different kind of imbalance. But again, those kinds of lessons are difficult to describe in a book, and really, really important. So it's a combination, really, of trying to maximize local production, trying to make farmers have a value in growing crops that are nutritious and healthy, and in some cases, again, helping them with irrigation systems, which they might not have needed in the past in the same way. So I think it's complex. I don't want us not to help, but I'd also like to see us problem solve together. What can we help you with? We've got some ideas about technology and such. How can we maximize your system, which is actually a good one? And people know how to grow teff. They know how to grow their own grains. Not so much on the other crops. It takes a long time, and that disrupts a whole cycle and a whole ecosystem, if you will. So I don't know if I answered your question, but okay. Any other questions? Yeah.
Are you going on a 2017 trip?
We're going to Zambia this year because, much to my great sadness, Ethiopia went into a state of emergency in October. We just got back, and two of the largest ethnic groups are kind of being suppressed by the government. And so the State Department issued a travel warning, and when a travel warning is out, you can't take students over. So we decided to go to Zambia because Zambia has some comparable situations, and it's a country that we don't have to do a lot of prep to get in and work. And we have our comparable World Food Program and NGOs that we can visit, and students with about the same amount of stunning. So we can help in some middle schools, and our students can learn. And we also always pair with a university in the country we're working in. And we take students from that university out with us. We pay them for helping us, and then our students get to have someone interpret and translate. It's a very mutually beneficial experience, and we try always to give to the community. We never just go and learn. We always do. We leave something. We give money to the schools. We pay. We took some of the kids to the dentist this past year that had really, really, really bad situations. Some that could easily, you could see having an infection that could go to the brain, that could literally kill them. We took them to the dentist. We got them antibiotics, and so again, it's always a give and take, and we are committed to Ethiopia if we can go back. But this year we'll go to Zambia just so that we keep. It's hard to get people interested in Africa, and we've now it's word of mouth. Students hear about it, they want to go, and so we're going.
Do you do it just through UNL, or is it through UNO, or can you take like Creighton students?
Well, we can take Creighton students. It's right now a UNL program, but this year we're actually going to partner even with a University of Mississippi, Ole Miss, and I have a former student who's now a professor there, and she's going to take students. So we're trying to expand. It's hard to keep a program afloat without having some other tentacles out, and I think that's actually something I'd like to see in Nebraska, is that the programs are across the state. But yes, we can take other students. And the other thing I should say, in fairness, it's expensive to go and study abroad. Very expensive, and it's expensive to go to Africa. And so we're trying to, again, find ways to make it cheaper. And one of the ways is to expand the pie and have other people go as well. So, yes. Anybody else have a question or a comment?
I just have a comment.
Sure.
This is really well thought of. And the way that you've accompanied students to this project, doing something that is academic service learning and just learning about a culture is very respectful. It shows that you have a lot of cultural humility.
Thank you. Thank you.
Tanzania has worse stunting, so you may want to look that way. But in comments about corn, for instance, in Central America, our corn is so cheap, so people stop growing corn. Well, then what happens when we have energy crisis and we need to use corn here for gasoline? We don't have a global mindset that our cars are taking food from the Central American farms that they can grow. But if I'm going and saying, do you want this or that? Well, of course. And especially because many of the cultures that I've worked with are so polite, they never will tell you what is really the truth. But we have to be looking beyond about the truth and come in relationships that are long enough with our global South neighbors to listen and to listen again and ask. Not the first time they'll say yes and not want to embarrass you. The second time and the third time. And it takes longer continuing relationships, going back. And when your name is called, your first name, as you get off the plane or off the bus or the train, and when your first name is called, you made it. But it comes from a cultural humility that it takes a while to develop that.
And that's part of the reason we want to still go to Ethiopia, because it's taken us so long to establish friendships and relationships and university colleagues and the communities, and so, thank you.
The seasons of stunting and the seasons of severe acute malnutrition, they break your heart.
They do. It's
And
very painful to see.
the mothers will see themselves last, and the mothers are also in 1,000 days very important for nourishing the one that's inside and the one that they're nursing. So it just breaks your heart.
Yeah. I think that most of the students write about the shock. I make them journal every day, and that first few days is overwhelming. But afterwards, it really does have an impact. It's hard to even describe, and you know it. But anyway, the academic part of this has all evolved through time and the sort of preparation. But we have established friends and acquaintances, and the students make friends there too, which is nice. They're long term. Okay. Any other questions, comments? Well,
Well, thank you.
thank you very much.